Hello, my name is Marla Berg-Weger. I'm going to talk to you for the next few minutes about how we can all help support older adults to drive more safely. This work is supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services. I also want to thank Annie Harmon, David Carr, and Tom Muser for their contributions to this presentation. Our objectives will be to increase awareness about older drivers, as well as looking at the knowledge about risks that occur to us as we age and that can impact our ability to drive safely. And then to learn a little bit about driving retirement and how we can help others and ourselves to begin to prepare for that when it's needed. Let's begin by looking at our mobility over the course of our lives. We go through several different transitions throughout our lifespan. You can see here, we begin our lives by being dependent on others to transport us where we need and want to go. Then we begin to move into semi-independent transportation by cycling and walking to the destinations we want to go. And as we reach near adulthood, most of us for decades then are able to be independent in our transportation, whether that's to continue cycling, walking, driving our own vehicle or another vehicle, and also using public transportation as well as private transportation. And then as we reach the end of our lives, many of us reach a point where we are not able to drive safely any longer, and we then become dependent on others for our transportation. Looking at older drivers as a group, we need to understand the differences and similarities between older drivers and drivers of other ages. We are an active group as we age. We prefer and rely on automobiles just as we did at younger points in our lives. And we see driving as something more than just a functional purpose. It has meaning for us, and that meaning is often attached to a sense of independence and being able to age successfully. Older drivers are very active. 75% of male drivers and 60% of female drivers who are 85 and older drive an average of 5 days per week. And 80% of older drivers continue driving after they have left the workforce. We tend to be a very safe group as we age and as drivers. We have fewer distractions typically. Take fewer risks and engage in less aggressive driving behaviors, do tend to drive at lower speeds. And as I'll talk about in a future slide, we tend, when we do get involved in a collision or an accident of some sort, we tend to do that differently than we were when we were younger drivers. Men do experience more crashes across the age span. And historically, women have tended to retire when they were still able to drive safely. Now, those gender kind of stereotypes are changing, certainly, but for the current population of older adults, these still really hold true. And as I said, the most important part to remember about older drivers is the personal meaning that is attached to being able to drive and to drive safely. When an older driver is involved in a collision, there is a difference between this and the younger driver. When an older driver is involved in a collision, they tend to be more seriously injured, have longer and more complicated recovery, and also are fatally injured at higher rates. The graphic that you see here in front of you shows the collision rates as we age. When we begin driving, somewhere in our teen years usually, the accident or collision rate is high due to inexperience. But that begins to go down significantly as we become more experienced drivers and age and mature. And you can see it stays fairly steady for a number of decades, but then begins to escalate again as we reach older adulthood. Function is the most important aspect of being able to drive safely, regardless of the age of the driver or any medical diagnosis or impairment. As you can see here, approximately 17% of older drivers do have an impairment in one of the four areas that's listed here. And I'll go into these in upcoming slides, but I'll mention them here. Vision, cognition, musculoskeletal flexibility, as well as strength, and then reaction time. So let's look at each of these individually. Vision is clearly a very critical skill in being able to operate any vehicle safely. But vision also is something that nearly all older adults experience changes in. Most of us, particularly in the acuity area, begin to, as we age, to be unable to see things as clearly as we might have been able to, or close up or far away. And many older adults require some kind of prescription corrective lenses. One has to have a 20/40 vision in the eye exam to be able to have an unrestricted license. A second area of vision change that can impact driving is contrast sensitivity. This is the inability to distinguish between different colors and different amounts of light. And I'll talk a little bit more about that in a future slide as well. Older adults who are experiencing contrast sensitivity often report difficulty seeing well at night, or particularly dealing with glare, whether it's from sunlight or oncoming vehicles. Depth perception is also a critical issue, and that's the ability to be able to see how far objects, particularly oncoming vehicles or parked vehicles, are from you. And we'll come back to that one as well. And then lastly, on the vision front, visual processing is when the eye sees something, but the brain isn't able to interpret its actual meaning. So let's look now at light. So as we age, we require twice the amount of light for every 10 to 13 years as we age after the age of 25 to be able to see the same picture, if you will. So the three images that are here on the slide show what one sees at age 20. Very clear picture, nice sunny day. By age 60, it's darkened and not quite as clear as it was. And you can see here, by 70, it's much darker. So think of that in terms of the older driver. Depth perception is a critical issue in driving, as I mentioned. The driver in the yellow car is the older adult. They are attempting to make a left-hand turn. They probably see the red car coming, but if they have depth perception declines that have occurred as a result of aging, they aren't going to be able to judge the distance. They perceive that the red car is further away than it is, so they go ahead, make the left-hand turn, and a collision ensues. Cognitive function is a critical part of the driving safely process. However, persons who are experiencing cognitive impairment in the form of dementia, Alzheimer's disease, and other dementias will experience difficulty in two particularly important areas for driving safely. One is strategic and tactical. That includes scanning your environment, anticipating where you're going, upcoming turns, etc. For someone who has a progressive dementia, they will eventually lose the ability to safely operate the vehicle, meaning just the tasks of moving the vehicle from one point to another. For most of us, driving is an overlearned behavior because we learn to drive at a much earlier point in our lives, and it's become a frequent activity that's almost automatic for many of us. And as one moves through progressive dementia, you are no longer safely able to operate that vehicle. So it's not a question of if the person with dementia has to stop driving. It's a question of when does that occur. For those in the very earliest stages of a progressive dementia, they may very well be able to drive safely, again, because it's an overlearned behavior. As one progresses into mild dementia, the person may be able to drive safely, but may not be able to. So it's important at this stage that the person is self-evaluating, as well as others who are around the older adult are also evaluating their ability to continue driving safely. And by the time someone reaches the moderate phase of a progressive dementia, it's nearly impossible that they are going to be able to continue driving safely. Medications can also be another particularly impactful aspect of one's ability to continue driving safely. As you can see here, nearly half of older men and more than half of older women take 5 or more medications a week, and 12% of persons who have reached older adulthood are taking 10 or more either non-prescription and or prescription medications every week. So we know that medications can have a variety of side effects on people, some of which change as we age. For instance, medications that have particular side effects can impair your functional abilities that also then will impact your driving in the areas of vision, cognition, and musculoskeletal. We also know that as we age, we respond differently to medications. So we metabolize medications at different rates, which can influence our ability to react and to be sensitive to the changes around us. Movement is another particularly important area to think about in terms of safe driving. For older adults who experience physical frailty, this often results in just a general slowing of body movements, weaknesses, as well as just a fatigue factor that occurs at an earlier time than it would, as we were younger. Kyphosis is curvature of the spine, which can diminish one's height and erectness. So if someone experiences kyphosis, we can actually have difficulty seeing over the steering wheel as well as the dashboard. Range of motion can come with a number of age-related changes, including arthritis, which is next here on the list. But range of motion is particularly important, being able to turn one's head and move your arms. So arthritis is one of the things that can impact your range of motion, as well as Parkinson's, which often results in a rigidity of one's motions and a slowing of movement. So Parkinson's also, in many cases, creates a tremor that older adults experiencing this have, and their hands and legs may shake. So those all impact one's ability on the operational side of driving safely. And then finally here is peripheral neuropathy. Neuropathy is the loss of sensation in one's legs and feet, which not only makes walking and driving more difficult, but it can create a sense of inability to feel the accelerator as well as the brake pedals. And you'll hear older adults who are experiencing neuropathy talk about the pedal's sticky or it's slippery, and they're not able to maintain their position to continue driving safely and to react, to move their legs and feet as needed when they need to brake, for instance. What happens then for the older adult who's experiencing some of these things that I've just shared with you, when they recognize themselves that possibly they should be thinking about retiring from driving, or someone else, including the licensing bureau or law enforcement, suggests that maybe this person is no longer safe to drive? What is that process like for older adults? Well, it's often engenders fear because we don't know what is going to happen if we cannot drive any longer. Remember, I made the comment that older drivers see driving as something that goes beyond just, transporting themselves from one location to the other. it's equated with independence. And if I can't do that any longer, what does that mean for my independence? And it's particularly hard for all older adults, but men historically have been sort of the designated drivers, and so have an even greater fear sometimes. I'm no longer able to drive my spouse or my children and grandchildren where they need to go. That all feeds into our sense of self-worth. And if I can't do the things I'm used to doing, what is my value now? Very few people actually plan for a time that they will retire from driving. In fact, less than 20% of us will engage in any kind of planful thinking, discussion, taking action to prepare ourselves for that point at which we reach a time when we can no longer drive safely and are willing to retire. What does driving retirement look like? Well, on average, we're probably going to continue living for a number of years longer. For men, they will likely live 6 years after they have stopped driving. Women, more likely to live up to 10 years longer. Again, this is a huge shift for people who relied on driving, but along with losing the ability to drive safely, they may also be experiencing losses in terms of health, their functional status, and so they're grappling with multiple losses to their sense of self-worth and well-being. Driving retirement is inextricably linked to our ability to engage in the world we live in, whether that is participating in community activities, visiting, socializing, working, volunteering, all of the things that are important to us, we fear that we're going to be losing. And as I said, very few people actually plan for ways to continue to be mobile and active once they can no longer drive themselves. And we have to be thinking about that in terms of what resources are out there that we can offer to people who are no longer able to drive. As a last resort, there are mechanisms in place in all 50 states to report unsafe driving for a driver of any age, but this relates particularly to older adults. Every state licensing agency has a reporting process. In 44 states, it's voluntary. In 6 states, mandatory reporting for certain medical conditions, including dementia, is required for specified professionals, often in the healthcare profession. In the state of Missouri, anyone can report any unsafe driving for any age driver. There are separate forms in the state of Missouri for the general person in the public community reporting, and that does include law enforcement, as well as for physicians and healthcare providers. The process, which is not dissimilar in most states, you make a referral to the state. The physician is asked to provide input. The person may be required to do written vision and or on-road testing, and then the licensing agency determines whether or not the person is safe to continue to drive. A comprehensive driver evaluation will include 3 distinct components: an interview with the person, administration of special screening tools for driving, and as well as observation and testing of one's ability to operate the vehicle. So in the interview, the evaluator will ask about the person's present situation and concerns, about their driving, about others' concerns about driving as well, that have been communicated to the person, history, and that will include health history as well as mobility and driving history. And then finally, what are the person's expectations and desires for their future mobility? How do they see themselves being able to get where they want and need to go if they were not able to drive? The screening that is conducted usually includes mental status screening, looking specifically for cognitive impairment, visual attention and tracking kinds of screening, and then one's emotional and attitudinal readiness for a mobility transition. Is the person concerned about their own driving, and have they been considering a time when they couldn't drive? And then lastly, there's functional assessments that are completed. A rapid pace walk, which looks for balance and fall risk, which certainly can impact driving, and then a behind the wheel driving assessment, if that's appropriate and has been requested. To wrap up, the takeaways around this brief presentation about safe driving as we age, it can be summed up by saying driving is a lot. It's a complex task that requires us to be functional, both vision, cognitively, and physically. But it can also be a risky behavior for regardless of one age. Driving is a risky behavior just inherently. You're navigating roads where lots of other people are also navigating the same roads, and maybe not everyone is safe or paying attention at the time. It can be expensive. It can also be political in the sense that there's a lot of governance around the issues of driving, and people other than yourself get to decide whether you can legally drive or not. On the more personal side, it means independence, which we've identified as also being very tied to one's sense of self-worth. It can be a status symbol, even if you have attached meaning about your self-worth to the type of vehicle that you operate. It's a very social activity for many people because it connects us to the world that we live in, to activities and family and friends, employment. And it's something that most of us share with most of the rest of the world. And so it's just ingrained as part of the world that we do live in. However, there are things, as we've discussed here, that impact our ability to drive and to drive safely. One can be non-ambulatory and yet still, with some compensatory strategies and assistive devices, be able to continue driving safely. One of the compensation strategies that people use as they age is they stop driving in high volume and high traffic kind of situations. They may stop driving during rush hour periods. They may stop driving on busy streets. They may limit their driving to daytime only. Those are compensatory strategies which can prolong one's ability to drive and drive safely past the point which maybe others are questioning that. We do know that 10 to 15% of older adults are not safe drivers, but yet they're still on the roads. And we also know that many, many older adults self-regulate. Some do require help from others to be able to either cut back on their driving or completely retire from driving. Timing is everything. If someone drives too long, they are past that point where they're physically safe to drive, and they're beginning then to endanger not only themselves, but others. And that is certainly something that none of us want anyone to experience. With that, I hope that this has been helpful and raised some issues for you that you may not have thought about. It does take a village for all of us to be mindful about safe driving. So as a professional working in the area, include it. Include questions about driving and make some observations about one's driving safety as you're working with your older patients. For more information, please contact the Family Center for Healthy Aging here at St. Louis University, at Memory Clinic at health.slu.edu, our website and phone number listed here, or feel free to reach out to me with questions. Thank you.